It's so interesting. Pregnancy and postpartum are often considered, the happiest time in somebody's life. But the truth of the matter is, it's a time of significant change, significant worry, physical change in body, physical change in emotions and hormones, and one's relationship with self, with partners, with family, with sort of the environment and the community. And so it's not surprising that mental health conditions are actually really incredibly common in pregnancy and the postpartum period. In fact, 1 in 5 pregnant or postpartum individuals will experience a mental health condition, which makes it really common and yet something that has a lot of stigma and we don't necessarily talk about. And so, here at UMass, we really have been doing work as it relates to perinatal mental health way above, way in advance of others, really recognizing it as the most common complication of pregnancy. And I hate to say it, but people should know this. It can be it is the most common cause of maternal mortality. And so it's something we must address. It really is a public health crisis and something, mental health in general has stigma. Mental health in women and mental health in pregnancy and postpartum seems to have more stigma, right? Because you should be happy, you're a mom, you have a baby, but being a new mom is hard. And so we have worked with various professional societies like the American College of OBGYN to create new, clinical practice guidelines to establish new care standards. We've worked with the Alliance on Innovation in Maternal Health to create patient safety bundles and have done a lot of work over the years talking to obstetricians to say what makes this hard to address. And partly, I'm an OBGYN. I received no training in mental health, right? Mental health training is often in psychiatry, for example. And so really doing a lot of work over the years to bring mental health training to OBGYNs, and for those that are already out in practice beyond their training, to support them with toolkits, with e-modules, with implementation guides for how to integrate mental health and obstetric care into their community. And here in Massachusetts, in the University of Massachusetts Medical School, UMass Memorial Health, we were the sort of first state to have what's called a perinatal psychiatry access program, which is a way for obstetric care clinicians to contact a perinatal psychiatrist to get help for the patient who's sitting with me here in the moment, who I'm worried about, and maybe I don't know what to do with. And so get immediate connection to that kind of expertise. And that model, that access program model, now exists in 24 other states, given the work that we've done here. And a colleague and I here at UMass Chan Medical School, UMass Memorial Health, have worked to create a national network of these programs so we can learn from each other, so we can work together, so we can further innovate the model to address improved maternal health outcomes, improved mental health outcomes, improved equity. And that really has been a base and foundation for a lot of the research and work that we do.